Hi there, everyone. Thank you so much for joining us for another informative edition of Jamaica Magazine. I'm your host, Adrian Atkinson. Inside the pages today, we explore digital transformation in public health, innovation in goat farming, and cybersecurity, plus more stories of Jamaica's development. It all unfolds starting with our news of the day right after this very important message. Stay with us.
Good day, I'm Twyla Whelan, and this is your JIS News for Monday, February 24, 2025. CARICOM must be prepared to maneuver changes in the United States trade policy. That's an area of concern discussed at the 48th regular meeting of the Conference of Heads of Government of CARICOM held in Barbados last week. Addressing a press briefing post-conference on Friday, Prime Minister Dr. Andrew Holness said leaders would be conducting a detailed review of CARICOM's trade arrangements with the U.S. to guide the way forward.
We hope that in another 3 or 4 months we will have a document which will give us a policy direction and give advice and support to the governments of the region as to how to treat with any potential change that may happen in U.S. foreign policy.
Dr. Holness says while many businesses have reached out to express grave concerns, the approach should not be of panic. He also asserts that CARICOM governments and businesses should not only look at the potential disruptions to normal trade routines, but also the opportunities that may arise.
The region has a well-established office for trade negotiations, and it has worked very well for us, and we are using the incredible resources in that office to study the challenges that could come and to provide us guidance, all the governments in the region, guidance as to how we should structure our trade policy to both mitigate any fallout but take advantage of the opportunities.
535 residents of Grange Pen in Rose Hall, St. James have now received certificates of title for their properties. The land titles were presented in a ceremony on Friday. This is the first phase of a project by the Housing Agency of Jamaica and the Tourism Enhancement Fund to regularize informal settlements through infrastructure developments and the granting of titles for properties that have been paid for in full. $964 million was spent to get infrastructure for the area ready, including the build-out of roadways and storm drains, as well as a water supply distribution and sewage collection system. Minister of Tourism, under which the TEF falls, and Member of Parliament for the area, Edmund Bartlett, says it is the responsibility of the government to intervene and provide necessary housing and supporting infrastructure for its people.
And whether you pay for it immediately, or you pay for it 20 years down the road, or 15 years down the road, you know that nobody is able to take you off that because the government, through its agency, acquired that, and it is now the property of the people of Jamaica. And you, as an individual person, will get an opportunity to have benefit from that.
He says phase 2 of the project is coming soon, offering 1,635 units to workers in the tourism industry. $8 billion has been budgeted to kick government's shared prosperity through accelerated improvement to our road network Spark project into high gear in the fiscal year that begins April 1. The 3-year project has a total budget of $45 billion, and this year's allocation is expected to bring the civil works to 40% completion. The main contractor is to be mobilized, pipelines and related materials bought, and the procurement of the required parcels of land completed. During a sitting of the House of Representatives earlier this month, Minister with responsibility for works Robert Morgan expressed excitement for the project and what was to come.
This is the next chapter of Jamaica's development. With the Spark program, we are not just fixing roads, we are building pathways of opportunity. This initiative is an investment in the future of our citizens and a demonstration of the government's unwavering commitment to national development.
As of December last year, civil works contracts have been awarded for packages 1 to 4, and the supervision consultancy contracts for packages 2 to 4 were awarded, while that for package 1 was retendered. Meanwhile, $100 million is being awarded to complete work on the Troy Bridge in Trelawney in the upcoming fiscal year. Earlier this month, the Works Minister reported that the bridge, which collapsed in August 2021 during the passage of Tropical Storm Grace, was 45% complete.
They have already embedded the piles. They are now capping the piles to put on the upper structure of the bridge.
While that work continues, a footbridge has been built to facilitate access for residents and other persons who normally use that route. Tax Administration Jamaica TAJ is reporting that over 4,000 uncollected payments under the Reverse Income Tax Credit Initiative are still awaiting collection at remittance agencies. The TAJ is urging all individuals who have not collected their payments to do so by March 7, 2025. After this date, the agency says any uncollected money will be returned to the Consolidated Fund as required by law. Since last October, the government has disbursed $6.9 billion under the Reverse Income Tax Credit Program, with approximately 300,000 individuals benefiting so far. Applications for the initiative are now closed. However, taxpayers can still visit the Reverse Income Tax Credit Hub to track the status of their applications and access relevant information. TAJ is reminding taxpayers to have a valid government-issued identification card and their transaction number on hand when collecting the disbursement. And finally, the Princess Margaret Hospital in St. Thomas has further boosted patient care at the facility by introducing its family care system. Senior Medical Officer Dr. Dwight Whittle says the system seeks to allow discussions with physicians as persons seek information on the health status of their family members. Patients and their families are allowed a sit-down dialogue with their physicians to discuss the patient's progress or lack thereof, as well as the resources that the hospital may or may not have and how to negotiate constraints.
Over the past decade, we have strived to make the patient experience better. We take complaints very seriously, and we have taken steps to mitigate against unfavorable events that a patient may experience during their course in the hospitals.
Dr. Whitlow speaking at a recent JIS think tank. He says the system is now part of the standard of care for all patients at Princess Margaret Hospital. Family conferences can be initiated by the physician through the Medical Records Department or a family member making a call or visit to the department, which would in turn contact the attending physician to ascertain a time convenient for the parties involved.
For the future, we would like to augment this program. We certainly would like to strengthen and allow for patients to be aware of it and to make use of it.
And that's it for JIS News Today. I'm Twyla Whelan. Thanks for watching.
Here's an important reason you need to avoid or limit alcohol consumption. The World Health Organization (WHO) indicates that there is research evidence of a direct link between several cancers and alcohol consumption as a major contributing factor. It's being cited as a major contributing fact for cancer of the breast, colorectal, esophagus, liver, mouth, throat or pharynx, and voice box or larynx. There is no safe level of alcohol consumption, and the more you consume, the greater your risk. Protect your health. Limit your alcohol intake. Save your life. For help and more information, call the National Council on Drug Abuse (NCDA) at 876-564-HELP. That's 876-564-4357.
A significant transformation is taking place within the public health sector, and technology is playing a big role. Have you heard about how the electronic health record system is modernizing and strengthening healthcare delivery? Well, here's your introduction.
The digital transformation of Jamaica's public health sector is progressing, and a key component is the implementation of an electronic health record EHR system.
Electronic Health Record System, System 1, or SI for short. When the patient comes for registration process, we would input the data on S1, and then this data will come around to wherever the doctor is or the nurse is. So they do not need to be waiting on health records to go and retrieve the paper record to bring to them. And if the patient comes with any investigation with the blood results, X-ray, any form of laboratory results or any external result, we would upload those at the time of registration. So when they come to the doctor and the nurse, the information is readily available.
Doctors will be able to see diagnostic scans on their computers and tablets remotely.
Right, and it also allows multiple persons to be retrieving the data simultaneously, or we can do data entry simultaneously.
You can actually measure time from arrival to time of triage, and thereafter every interaction with every member of staff is actually timed. So it is good for tracking, whereas the previous system, if the doctor or the nurse never actually wrote the time that they were seeing, it doesn't get tracked as easily.
It's a shift from paper-based health records management that is allowing improved patient care coordination, enhanced data accuracy, and better decision-making by medical personnel.
The names come up on the system, and as they are seen, there's a color change, so you know which one is seen by the nurse, which one is already seen by the doctor, which one is discharged. So each one of those, if there's no color change, you know that person has not yet been seen. So in terms of efficiency, that's excellent.
The EHR is being implemented by the Ministry of Health as part of the Health Systems Strengthening Project, valued at over $5 million. The EHR allows for not just patient registration, but also appointment scheduling and patient assignment in the triage process.
I know that for the outpatients department, definitely throughput is much faster, and the chances of people getting missed or neglected in the clinic is almost nil now.
The system, which is intended to go island-wide, is being initially rolled out in 13 health facilities over an 18-month period. Maypen Hospital was the first to operationalize the electronic health record system.
The reason why we were the first, I think, is because we were the most ready to receive and accept such a new system.
The first phase rollout will also include the Chapelton, Spanish Town, and St. Anne's Bay hospitals, as well as the Maypen West, Maypen East, and St. Jago health centers.
A patient arrived in the accident and emergency department and wasn't able to give adequate information. This patient was just being treated next door by the St. Jago Park Health Center, and we were able to pull up that information and to continue care. And so we are at a good place in public health. We are exciting, and I'm sure that the patient will get timely medical care.
As a nurse in charge of the labor ward, for me, I have my 24-hour reports on a daily basis, and I am able to get the information at the end of the day for each client. Easy accessible, one click away.
The island-wide rollout will network more than 2,000 computers and 400-plus medical-grade tablets that provide universal access to medical records. The electronic health record platform is based on the philosophy of one patient, one record, and is part of the plan for improving efficiency in access to medical services.
And what that means is that whatever data that is inputted concerning the patient when they come to see a doctor at a health center or hospital in this case, that data is pulled up based on their unique identification number. And you immediately know the history of the patient and therefore all the factors that may influence a treatment regime in a much quicker way.
With EHR, there is no challenge with locating your health records, and so care is timely and on point.
Data for the EHR is stored securely on multiple servers, and only authorized persons are allowed access.
The confidentiality of the patient's record is actually critical. So it's not like anybody can get anybody's record at any time. There has to be special permission from the medical records department to actually release the notes and then that's the only way we can access it.
The system is expected to accrue significant savings of time and cost on tests that won't have to be repeated. The data generated will also assist in the formulation of better evidence-based policy making and program design by the government.
Regarding the staff, if you ask any of them if they want to go back to the paper system, you get a resounding no. They do not want to go back to the paper system.
In the heart of the Caribbean lies a beacon of financial opportunity. Welcome to Jamaica, where beauty and vibrance meet business and innovation. At the forefront of making Jamaica a robust financial hub, the Jamaica International Financial Services Authority leads the charge with trust and integrity.
Here at JIFSA, our mandate is centered around stimulating economic growth and investment in the Jamaican economy through legislation.
Through legislation, JIFSA has had acts modeled on laws of leading financial services jurisdictions worldwide. The legislation includes the Trusts Act, which allows for flexibility in succession planning and family offices, the Trust and Corporate Services Providers Act, which regulates the provision of fiduciary services, as well as the Partnership Limited Act.
At JIFSA, our aim is to foster economic diversification and boost Jamaica's economic landscape.
JIFSA takes pride in cultivating a business environment that supports growth and sustainability through innovation. JIFSA is a partner that will guarantee new opportunities. Join us in Jamaica, where the Jamaica International Financial Services Authority helps you embark on a journey of endless possibilities. JIFSA, new legislation, new opportunities. Agriculture and food security are crucial for sustainable growth and economic development. In our next feature, we'll learn how one goat farmer is bringing innovation to producing and marketing goat meat. His mission and that of the government is to improve sustainability and profitability in this area of the business of farming.
How did I get here? The Ministry of Agriculture, Fisheries and Mining has initiated a transformative step to bolster the small ruminant sector on the island. The call is for local farmers to dive into goat rearing with renewed enthusiasm. This encouragement comes with a significant financial incentive: the removal of General Consumption Tax, GCT, and a duty cost for those importing goats to enhance their breeding stock.
Thanks for stopping by again, Kadia.
What is certain is that one of our goat farmers has already answered the call, and we set out to discover what sparked his interest and how his goat rearing business is progressing.
We actually started goat farming in 2019, so this is our 5th year that we've been in the business, and we got our first set of goats from Unity Boar Goat Farm in Mandeville. We started with a full-blood boar ram, and then from there we started to like the business because it's kind of compound interest. You know, one mother gave 2 kids and it grows from there. All right, well, in the mornings we come in, first thing you do, you go through the pens and you observe. So this is the maternity ward where we have the mothers with young kids on them. So you want to go through in the day and make sure nobody got squashed, there's no illness, there's no lameness with the legs or anything like that. And then we take the kids from the mothers and put them in a creeper feed, where we introduce them to their own feed and water. And this helps to get the ruminants started, where they pick on hay, so that when it's time to wean them off, they are independent of the parents.
I sure enjoy eating curried goat, but touching live ones takes some getting used to.
Then we get our grains from Hypro, and we go through and feed the grains to the different mothers. So each mother gets about 2 pounds of grains each day to sustain as a supplement to the grass and the water that they get. And from there now we move on to the other goats that release in pasture. Being in the business for 4 years and observing my other colleagues in the business, I said to myself, how do I separate myself from the traditional goat farmer?
And you can only separate yourself when you have mastered the basics and are ready to take on a new challenge.
Everybody's just selling goat meat and everybody's enjoying goat meat as curry goat. But then there are many other ways to enjoy goat meat. There's goat sausage, there's goat burger, which is jam goat. You can also have goat pasta, and we have other ideas in line, maybe even goat nuggets. So I decided to put on my thinking hat with my family members and came up with an innovative way of where we can enjoy meat. Plus, goat is actually healthier red meat.
As he said, traditionally, Jamaicans have incorporated goat meat into dishes like curried goat and manish water. But the shocking truth, according to the Ministry of Agriculture, is that over 80% of what we consume as goat meat is actually imported sheep. This revelation shows the importance of supporting local goat farming and that we need to explore diverse ways to prepare and enjoy genuine goat meat. This is where the magic happens. We are now in the agro-processing section of this farm where goat meat is transformed into delectable goat burgers. Although we couldn't capture every step of the process, I can assure you that the journey from raw goat meat to gourmet jam goat burgers exemplifies the statement, your gift will make room for you. I certainly put in the work today as I uncovered the ebbs and flows of goat rearing. But one question remains, is it a lucrative business?
Think about taking $10, putting it aside, coming back, and that $10 is now $40. And then you take that $40 with your $10, put it aside, and come back and it's now $120. Goats to me is a true definition of compound interest. One female goat can give you up to 4 kids. And those 4 kids, if female, can multiply and give you another 4 kids. So, and plus, when you look at our economy, Jamaica is importing $15 million worth of goat meat each year. So the market is wide open for everybody to come and diversify and take a piece of the pie. So why not come and join?
Before we leave, we decided to request one takeaway for the journey.
Mr. Henry,
can you provide me with advice on how to make this business a success?
Definitely, Katie. With proper planning, proper numbers, calculating your birth season, your kidding season, and what you're trying to market, you have to do all of that so that you can make the success come to reality. And that's how we end up with the idea of
a jam goat burger, of course.
Now that we have developed a goat burger, you can see the tremendous possibilities.
Computer technology has become an integral part of our day-to-day lives, proving necessary for work, education, communication, shopping, entertainment, and so much more. But the convenience and ease of having all that information at your fingertips requires us to protect ourselves from online crimes. In the few remaining minutes of Jamaica Magazine, technology experts share valuable safety tips on how to do just that.
Cybercriminal activities are on the rise, affecting the lives of people worldwide, resulting in a need to increase the awareness of all citizens. The Ministry of Science, Energy and Technology has been making the internet more accessible to all of us, but with that comes greater responsibility.
As the government aggressively moves to creating the digital knowledge-based society, it is very important to ensure that citizens, businesses, everybody understands the responsibility that comes along with using technology. The government of Jamaica continues to move with help from the Universal Service Fund, which is an agency under the ministry, to broaden access to technology and the internet by creating public Wi-Fi services and deploying community access points. This is an effort to ensure that everyone has access to the internet and cyberspace.
The ever-increasing popularity of social media platforms and its dark side has prompted the Stop, Think, Connect campaign.
Stop, Think, Connect brings out general safety practices, and we encourage persons to stop and think. Actually, you find at times you're going to post a selfie, for example, and you take that selfie. We encourage you to stop and think before you actually post that selfie. Is it necessary to post? Do the people really need to see this? Do I really need to post this? What effect can it have in the future?
Stop, Think, Connect is not just geared towards our personal use of the internet. It should be incorporated in our work lives as well.
Cybersecurity in the workplace is everyone's business. A lot of institutions worldwide, and Jamaica is not excluded from this, have been impacted by ransomware and other malware. A lot of times what we find is that it's that end user that clicked on an email link, an attachment, or went to a website that they shouldn't have. We have to make an effort now to not only educate users, but actual persons at all levels within institution to be aware of the threat that is out there. Because when an organized cybercrime is coming, it's usually targeted at critical infrastructure.
Critical infrastructure such as energy, water, telecoms, and media are just some of the targeted areas. Ignore pop-ups when they appear on your computer and never trust emails from questionable sources. By opening any of the following, you may be giving a virus a free access pass to your devices. There are several antivirus and anti-malware software on the market. Use them. And also remember to keep your private information private. Passwords, driver's license, national identification number, traveling and banking information should not be saved on public computers. Cybersecurity is our shared responsibility. Let's play our part. Stop, think, connect.
Our half-hour journey through the pages of Jamaica Magazine ends right here for today, but please do join us again tomorrow right here on this same station for more news, features and information you can use to live, work, raise families, do business, and of course, retire in paradise. In the meantime, visit our website, jis.gov.jm, for this and other offerings. On behalf of the entire production team, I'm Adrian Atkinson. Until next time, walk good.
This has been a production of the Jamaica Information Service, the voice of Jamaica.